What's up, everybody? My name's Brian Brosey. I'm a physical therapist, B.Well Physical Therapy and Wellness, co-host of the Well Man's podcast. Talked a lot about glute training, working on our external rotator strength. I'm going to demonstrate one of my favorite external rotator exercises where it is very difficult and we get into a figure 4 position like I discussed on the podcast. I'll link to the podcast where I talk about this above. So I'm going to go ahead and get into position, and I'm going to be doing this on my right side for the sake of this video. And the right side happens to be my weak external rotating glute. So I'm going to get into that figure 4 position. This is what I mean by figure 4. I got the 4 there. I'm going to try and rest my head and not push. I can compensate in all sorts of ways by pushing into the floor or rotating out like this. You'll see once I'm doing it. And I want to try and minimize all those compensations, obviously. So I'm going to do a few reps here. I always start by squeezing my other glute and trying to keep that engaged as well. So you'll see that kind of tightening. And then you'll see what I'm going to try and do is do external rotation, lift my knee off the ground without compensating like I am to talk to you, and lift up like this, and without pushing so much through the foot, but the foot is going to be on the ground. If you get strong enough or you feel like you're ready to progress, you can check out my other video where I talk about the hip lift and hold, and we're really working on external rotation and abduction there. It is a difficult exercise. You are put in a position that makes it even more difficult, but it is great to really develop. I like it more than clamshells, which you may have done in traditional physical therapy, where you lay here, maybe you have a band, maybe you don't, and you lift the hip like this, just rotating it out. I like this a lot more because, one, you're put into this compromising position, or this position that makes it a little bit more difficult already. You're already in a lot of external rotation. And I feel like being prone on my belly, being in that position, I feel it work my external rotators a lot more, and I'm able to connect with them and have less likelihood, as long as I'm not pushing through the ground or rotating out, of those types of compensations we see with traditional clamshells, or if you're compensating in that version that I showed. I do suggest that you start by holding the repetition. So like you saw me do, I raised my knee up, held for 5 seconds, and then slowly tried to let it go back down. Again, that's just external rotation that we're working on, really helping stabilize the hip, distribute some forces properly through the hip, and develop external rotator strength of the hip. My name is Brian Brosey, B.Well Physical Therapy and Wellness, co-host of the Well Man's podcast, and until next time, be well.